Typical thoracic vertebra. But before starting the typical thoracic vertebra, we should have certain understanding of the vertebral column. Okay, so vertebral column, also known as spine or backbone or spinal column. Okay, so this is our vertebral column. This whole thing is our vertebral column. Why this vertebral column is important? To maintain the posture. Then this is the spinal cord only. How will it support? It is the supporting part only. Okay, so basically the the spinal nerves or the spinal cord, yes, the spinal cord. So basically the spinal cord passes through this vertebra. Okay, so the spinal cord passes through this vertebra, so that is why it is known as spine. It provides a protection to all the nerves that comes from our brain. Okay, so basically its another purpose is to transfer our body weight to our lower limbs. Okay, with the help of this intervertebral disc as well as the whole transverse process, as well as the, we'll see one by one these things. Okay, so basically there are how many vertebrae in our body? How many vertebra? Not 12. 12 is thoracic only. So vertebra are divided into cervical, then thoracic, lumbar, sacrum, and coccyx. So there are how many cervical vertebra? 7 cervical vertebra. How many thoracic vertebra? 12 thoracic vertebra. How many lumbar vertebra? 5 lumbar vertebra. Then sacral, 5. And coccyx, 4. So this fusion occurs later on the life, but initially these vertebrae are present in our body. Later on these 4 vertebrae get fused and forms a single coccyx, but in initial phase we have total 33 number of vertebrae. Now the next thing that you should know, is about the spinal nerves. So the entire central nervous system is divided into our brain and spinal cord. Brain and spinal cord. Okay. So, and rest all other nerves that you study in our body, this constitute the peripheral nervous system. Parts of autonomic nervous system, these things are present. So brain and spinal cord form the CNS. So brain is covered in the skull. This spinal cord is covered in our vertebral column. So it is covered by skull. And the spinal cord is covered by vertebral column. Now from the spinal cord, spinal nerves arises. So these spinal nerves, from one vertebra, usually one spinal nerve, from the spinal cord passing through one vertebra, one spinal nerve arises on either side. So ideally, if there are 33 vertebra, how many spinal nerves should be there ideally? No, 31 only, 33. Ideally, if one spinal nerve arises from one vertebra, along one vertebra, then there should be 33 spinal nerves. But this is not the case. So usually there are 31 spinal nerves in our body. We will see how. So spinal nerves are 31. So basically what happens from this cervical vertebra? This cervical vertebra, one spinal nerve arises from the upper part of each one of this cervical vertebra. Okay. Suppose this is your cervical C1 vertebra. So one nerve arising from the upper surface. Then from C2, another nerve arising. C3, third nerve. Similarly, C4, C5, C6 and C7. So from each one of them, one nerve is arising. Suppose the spinal cord, suppose this is your spinal cord. So the spinal cord is passing like this through the vertebral foramen. So from each one of them, this 1, 2, 3, 4, 5, 6, 7, these spinal nerves are arising. But in case of the eighth spinal nerve, that is the eighth cervical nerve. This is arising from the lower half. Okay, so C1, C2, C3, C4, C5, C6, C7, and there is another C8, 8 cervical nerves. So we have 7 cervical vertebra, but 8 cervical nerves. 7 are arising from the upper surface of the cervical vertebra, and the 8th one is arising from the lower part. So thus forming for 7 cervical vertebra, we have 8 spinal nerves. Okay. Now coming to the thoracic vertebra. So for thoracic vertebra, there is T1 to T12. There is no abnormality. 12 thoracic vertebra, 12 thoracic nerves only. Okay, 12 thoracic nerves. Each one of them is coming from the, it is continuing the same pattern. It is coming, since C8 is coming from the lower part of the C7 vertebra, then comes the T1 spinal nerve. This is not vertebra, these are spinal nerves. They have the same name as the vertebra also, okay. So for 12 thoracic vertebra, we have 12 thoracic nerves. Each one of them is coming from the lower surface of the corresponding vertebra. So if this is my T1, this is my T2, and suppose this is my T3. So spinal cord is passing through like this, then T1 will be coming from the lower surface of T1, T2 spinal nerve will be coming from the lower surface of T2 thoracic vertebra, T3 will be coming from the lower surface of T3 thoracic vertebra. Got it? Similarly, 12 thoracic nerves will be coming from the 12 corresponding vertebra. So we got our 12 thoracic vertebra. Now similar case is with our lumbar. In lumbar also we have 5 lumbar spinal nerves. In case of sacrum we have 5 sacrum spinal nerves. But in case of coccyx we have only 1 coccygeal nerve. Because coccyx gets fused, these 4 coccygeal vertebra gets fused together and forms a single bone, as we can see in this vertebral column also. See, this is the coccyx. This 4 bone has fused together to form a single coccyx bone. So through it passes only 1 coccygeal nerve. So how many spinal nerves in total we got? 8 plus 2, 8 plus 12, 20, 25, 30, 31. So in total we got 33 vertebra during our birth, and we got 31 spinal nerves. Okay. So vertebral column, also known as spine as well as spinal column or backbone. So it forms the central axis of our body. It supports body weight and transmits it to the ground through lower limbs. We have discussed this part also. 7 cervical vertebra, 12 thoracic vertebra, 5 lumbar vertebra, 5 sacral, and 4 coccygeal vertebra. Now spinal nerves, we have discussed these things. Now classification based on mobility. Don't try to memorize these things. Try to have certain understanding of these things, so it will be much more easy. If you are not understanding certain parts, leave those things. At least try to understand the basic things. So if you know the basic things, those parts will be very much easy. So classification based on mobility. So what do you mean by mobility? So mobility means movement. So in simple terms, out of the 5 classification of vertebra, cervical, thoracic, lumbar, sacral, and coccyx, which are mobile vertebra and which are non-mobile vertebra. So basically we can turn our neck like this and do like this. So our cervical vertebra is movable. So mobile vertebra, cervical vertebra, we got cervical vertebra is mobile. Now we can do like this. So our thoracic vertebra as well as our lumbar vertebra, these things are also mobile. We can bend forward, so our lumbar vertebra is mobile. Okay. So mobile vertebra are cervical, thoracic, and lumbar. Now coming to non-mobile vertebra. So the other 2 vertebrae are non-mobile. Because we cannot move our sacrum as well as coccyx. These things we cannot move. This part is our sacrum and this is our coccyx. So this whole part we cannot move. Okay. So non-mobile are sacrum and coccyx. So mobile vertebra, non-mobile vertebra. Now length of vertebral column in males is 70 centimeter and in case of females it is 60 centimeter. So it is a bit lengthier in case of males. The intervertebral discs contribute 1/5 of the length of the vertebral column. So out of this 70 centimeter in case of males, 14 centimeter is due to these intervertebral discs, and in case of females almost 12 centimeter is due to intervertebral discs. What do you mean by intervertebral discs? So in between this vertebral column, this is one vertebra, this is another vertebra, in between them there is one intervertebral space. So this intervertebral space is occupied by intervertebral disc. Okay. So basically this intervertebral disc has two parts. This intervertebral disc, suppose this is your intervertebral disc as you see from above. It has two parts. Okay. The outer part is known as anulus fibrosus. Okay. And in between them we have another part. This is known as nucleus pulposus. Do you know any clinical anatomy regarding this intervertebral disc? I think you are getting this thing now. I mean, one vertebra is present like this, another vertebra is present backward. Like you are seeing from, if you are seeing from above downwards, then intervertebral disc in the transverse section, it will look like this. Okay. So why this is important? Because in case of our, sometimes in case up to 20 years of age, this anulus fibrosus, that is the outer covering, is very much thick. Okay. But as we grow older, up to 20 years, then after 20 years, we are getting older. Okay. We are leaving our adolescent phase. So as we go into our young adult stage, this anulus fibrosus, they get weaker. When it gets weaker, so during any case of strain, okay, suppose any injury or you fall from bed or anyone falls from bed, or in case of doing heavy weightlifting, this anulus fibrosus, this get broken. Now if this anulus fibrosus get broken, then what will happen? If the outer covering will get broken, then what will happen? This nucleus pulposus will come outwards. This nucleus pulposus will come outwards. What we call it? We call it prolapsed disc. Prolapsed disc. Okay. This nucleus pulposus come outward of the intervertebral disc. We call it prolapsed disc. Okay. This prolapsed disc, what it does? So along the sides of the spinal cord, vertebra, the spinal nerves come out. So this prolapsed disc, they compress the spinal nerve. So due to compression of the spinal nerves, pain occurs. So due to this, usually this prolapsed disc occur at the lumbar vertebra region. So here you will see the sciatic nerve, the origin for the sciatic nerve goes downwards. Okay. So due to this reason, since more common it is in L4, L5. Okay. This vertebral disc prolapse occur in L4, L5. So due to this reason, the spinal nerve gets compressed and the sciatic nerve also gets compressed. So we get one clinical condition which is known as sciatica. Okay. This is known as sciatica. So here the sciatic nerve gets inflamed. See. Since the vertebral column is of variation, there is variation in width of the vertebral column. Okay. So the cervical vertebra is, have less diameter than the thoracic vertebra. Then there is lumbar vertebra which is wider. So due to this reason, the whole vertebral column is divided into 4 pyramids. Okay. These 4 pyramids. So this is one disc, this is one pyramid. Between C7 and T1 vertebra, we get this pyramid, and between here between disc space of T4, T5, we get another pyramid. This is one pyramid, this is another pyramid, this is the last pyramid. So here you will see this pyramid, this diameter is very narrow. So this part becomes one of the weakest part, so this part becomes weakest part. So how it is supported, how the weight is then transferred to our lower limbs. Because this is a narrow part, the ribs come through this region, and we have the sternum also. This sternum as well as the ribs are present here. So this narrow part is compensated by the weight of this sternum as well as ribs. Okay, that is why this is how it is compensated, this narrow part of the vertebral column. Now curvatures. So basically during our, when a baby is born, it has a curvature like this. The vertebral column in a baby is somewhat like this. Okay, so this, and this is your sacral. So basically in child, when a child is born, it has got a primary curvature like this. So you will see that a child usually stays bent like this. Their vertebral column is bent. This happens up to 1 year of age. And after that what happens, not actually 1 year of age, this is a situation at birth. Then in pediatrics you will study developmental milestones. So a child first of all starts smiling at a certain age, then starts to call her mother, call her father, as well as call parents at a certain age, then starts on standing at a certain age, hold their neck at a certain age. So basically a baby holds its neck at 4 to 5 months of age. What is holding neck means? When a baby is born, they keep on lying on their bed. So the first step when the baby starts to hold their neck and tries to do like this is holding their neck. So they are trying to stand up, sit from lying down position. So that is holding the neck. This happens during 4 to 5 months of age. This is your primary curvature. This is your primary curvature. At 4 to 5 months of age, this is your cervical region. At 4 to 5 months of age, your cervical region, the first secondary curvature occurs. So this is your cervical vertebra. This is the thoracic, this is the lumbar, this is the sacral. Coccyx to small part. So this cervical vertebra becomes a bit convex during 4 to 5 months of age. Then after 4 to 5 months of age, at the age of 12 months to 18 months, that is 1 year to 1.5 years, the child starts to stand up. Okay, stand up. So then which vertebra we need? Lumbar vertebra. So at 12 to 18 months of age, our vertebral column will look like this. This is the cervical, then the thoracic, then the lumbar, then the sacral. This is our secondary curvature, which gets completed by 18 months of age. Okay. See, this is how a baby is born. This is your thoracic vertebra having a concavity in the front. This is your sacral vertebra having another concavity in front. This cervical and lumbar, these are almost straight. Okay, these are almost straight. This is not concave. This whole thing is in a straight position. In between them, there is no curvature like this. But in case of thoracic, there is a curvature like this. Similarly, in lumbar, there is no curvature. In case of sacral, there is one concave curvature like this. But as a child grows older, at 4 to 6 months of age, this convexity happens when the child holds its neck. Then when he or she stands, then this lumbar curvature, these are secondary curvatures. This secondary curvature occurs. So basically this curvature adds to elasticity of the spine. So it helps in better movement of the spine as well as better standing as well as doing day-to-day activities of the spine. Now coming to parts of a typical vertebra. A typical vertebra, not a typical thoracic vertebra. Okay, parts of a typical vertebra. Let us try to understand without seeing the picture. So first of all, this is the body. This is your body. Okay, this is the body of the vertebra. this is the anterior surface and this is your posterior surface. Okay, this is your posterior surface. Now from the body to bony projection comes like this. These are your pedicles. These are your pedicles. Now these pedicles form, one bonding with another bone, that is your lamina. This is your lamina. Then these two lamina together fuses on the extreme posterior part. Try to understand the structure, don't look at my drawing. So basically these two lamina together form one process. This is your spinous process. And from the junction of this pedicle and lamina, we have another process on either side. These are your transverse process. Got it? We will have a recap of this thing. See. So this is your vertebra. Body of the vertebra. From this body on the posterior part, I am getting two pedicles like this. These two pedicles gets joined with the lamina. This is your lamina. These two lamina gets fused together to form the spinous process. And from this pedicle and lamina, we get two transverse process. Now on this body, on the superior surface of the body, we have superior costal facet. And on the inferior surface, we have inferior costal facet. This is from the superior view, so you cannot see the inferior part. So we get the superior costal facet on the superior part and inferior costal facet on the inferior part. This costal facets, as the name suggests, is for what purpose? For articulating with costal ribs. For articulating with ribs. So basically, this is your vertebra. On the superior surface, there are two facets. See these facets. Here will be the two facets. With these two facets, the vertebra will come and attach. Okay? The vertebra will come and attach with this facet. So basically, what happens? Corresponding vertebra, corresponding rib attaches with the corresponding vertebra at the superior costal facet. And the lower rib will be articulating with the inferior costal facet. What did I mean? So if this is our T5 vertebra, then the fifth rib will be articulating with this superior costal facet. These are demifacet, okay? And on the inferior costal facet, will be articulating the sixth rib superior part, okay? And on this transverse process, we have facet for tubercle of rib. On the transverse process, we have facet for tubercle of rib. And these are superior articular process arising from the junction of this lamina as well as the pedicle. Pedicle as well as lamina. We get this bony projection known as the superior articular process. What is the function of this superior articular process? It articulates with the superior vertebra. Okay, if this is my T5 vertebra, then this superior articular process will be articulating with the inferior articular process of the T4 vertebra. This is the function of superior articular process, and we will also see the inferior articular process. And this pedicle and lamina, together they form this neural arch. This is known as neural arch. This is like a shape of an arch, no? So this is neural arch or vertebral arch, same thing. Now vertebral foramen. See, this is your vertebral foramen. So what passes through this vertebral foramen? Spinal cord, okay? So these transverse processes are mainly made up of two elements. One is the costal element, another one is the transverse element. So usually these two elements are together in a single transverse process, but in case of thoracic vertebra, these two units are separate, okay? Now coming to this notch. This is the superior vertebral notch, this is the inferior vertebral notch. How is these things formed? So basically this is the body of the vertebra. And this is your pedicle. This is your pedicle. Okay, the diameter of the pedicle, vertical diameter of the pedicle is narrower as compared to the vertical diameter of the body. So when these two bones get joined together during ossification period, one notch develops. This is your inferior vertebral notch, and on the superior part we get superior vertebral notch. Why this notch is important? So basically when these two vertebra gets articulated with one another using the superior and inferior articular process. So what I am saying, one vertebra, another vertebra, these two vertebrae are getting articulated with one another using this articular process of the vertebra. These notches turn into a foramen, right? These notches turn into a foramen. So through this foramen, dorsal and ventral rami of spinal nerves comes out. So through the vertebral column, spinal cord passes. From the spinal cord we get spinal nerves. Each one of the spinal nerves has a anterior division and a posterior division. So this dorsal and ventral rami comes out through this spinal nerves. Okay, so this vertebral foramen. Okay, superior and inferior vertebral foramen. This is your superior vertebral notch, here is your inferior vertebral notch. Similarly, this is your superior vertebral notch and inferior vertebral notch. So when these two bones will be combined with one another, there will be one foramen. See the foramen. This is the foramen. This foramen occurs. Through this foramen, the dorsal and the ventral rami of the spinal nerves comes out. Now coming to thoracic vertebra proper. So basically our thoracic vertebra are of two types, typical vertebra and atypical vertebra. How to identify thoracic vertebra? By seeing the body. So basically the body of thoracic vertebra, as you can see, this is like the shape of an heart. Heart means heart, okay? Not our anatomical heart, but this heart. I am drawing an yellow heart. So basically the thoracic vertebra, this part, our body is in the shape of a heart. Okay. Similarly, there is different shape for cervical vertebra, kidney shape. You will study in the subsequent classes. So the thoracic vertebra are identified by the presence of costal facet. Obviously, costal facets will be there. Costal facet means the facet for the ribs. So this ribs attaches with the thoracic vertebra only. So they will be having a costal facet on the transverse process. Then this costal facet may be two or only one on each side depending on the vertebra. Thus we know which are the typical and the atypical vertebra. Today we will be studying only the typical vertebrae. So the typical vertebra are from 2nd to 8th thoracic vertebra. 2, 3, 4, 5, 6, 7, 8. These are our typical thoracic vertebra. And atypical thoracic vertebra is T1, T9, T10, T11 and T12. Why T1 is atypical thoracic vertebra? Because it has certain features of cervical vertebra. Similarly, these also has certain features of our lumbar vertebra. That is why these are atypical vertebra. Now these things has already been covered. Suppose this is T5 thoracic vertebra. It will have a superior costal demifacet for the head of the 5th rib. Why demifacet? Because on the upper side T4 will come and both superior demifacet of this T5 vertebra and inferior demifacet of T4 vertebra will form a complete facet like this. In this facet, the head of the rib will be coming and joining or articulating. Okay. So this is known as demifacet. So on the superior surface, as I have already told, of the thoracic vertebra, on the superior costal demifacet, the corresponding rib will come and join. So in T5, on the superior side, T5 only will come. But on the inferior demifacet, this will be forming a complete demifacet with the T6 thoracic vertebra. So T6 vertebra will be come and joining here. So what it has been written? Superior costal demifacet for head of 5th rib and inferior costal demifacet for head of 6th rib. Because the other half will be attaching on the superior demifacet of the 6th rib again. Okay. And this is your transverse process, which is sharp laterally, going sharp laterally. This is the transverse process. So this transverse process will have the costal facet for the tubercle of the rib. Okay, tubercle of the rib. This is your inferior articular process arising directly from the lamina part. This is your superior articular process arising from the junction of the pedicle and the lamina. So, point to be noted that superior articular process arises from the junction of pedicle and lamina, but inferior articular process arises directly from the lamina itself. Okay? Then this is the spinous process. So, in case of thoracic vertebra, the spinous process is more of vertical in shape. As you can see, these are your cervical vertebra. These are pointed, but in case of this thoracic vertebra, this spinous process are present vertically downwards. They go vertically downwards like this. See, this is how it is present. It is present vertically downwards like this. But in case of our cervical vertebra, this spinous process is like this, pointed. So you can palpate one bone here. Here on your neck, back side of the neck, you can palpate one bone. This is the spinous process of your C7 vertebra. Okay, this is the spinous process of your C7 vertebra. See, C1, C2, C3, C4, C5, C6, C. This C7 vertebra. This is more pointed. C7 vertebra is more pointed, and just below the C7 vertebra starts our T1 vertebra, which is the spinous process is projecting downwards. Okay, so basically in C5 to C9, T5 to T9, it is more vertical. In case of T5 to T9, that is 5th thoracic vertebra to 9th thoracic vertebra, it is more, vertically downwards, overlapping one another. See, at the lower part, it keeps on overlapping with one another. Then these notches have been covered through which the dorsal and the ventral rim of the spinal nerves come. So these things are. These are not made by pedicle. These are made due to, partially by the pedicle, but these are formed due to the narrower diameter of the pedicle. Bujichish? Narrower diameter of the pedicle. So, see, this is the body. So, this is your body. This is your pedicle. So, this pedicle has a narrow vertical diameter and this body has a wider vertical diameter. That is how the notch is formed due to the asymmetry of both the bones, not individual bones. Okay. So, these things has been already covered. Body, vertebral foramen. So, the vertebral foramen is comparatively smaller and circular in case of thoracic vertebra. Now, there is vertebral arch. So these things has already been covered only. So basically, this is your vertebral arch. This is your vertebral arch. From this vertebral arch, pedicle arises. So then this transverse process arises. Then lamina, then spinous process. In case of thoracic vertebra, the spinous process are more vertically downwards placed. These transverse process are more placed laterally, straight laterally. So these are the certain features of vertebral arch. The transverse processes are made up of two elements, already been said. So basically, what I have said that this superior vertebral notch and inferior vertebral notch articulates with one another vertebra. Basically, not this notch. Here, one facet presents. This facet articulates with another vertebra. Okay. So this facet articulates. So this notch has this facet. This facet articulates with one another. Same thing only. Now coming to attachments. So basically this is the body. So from the upper border of the body you will see the anterior longitudinal ligament, and on the posterior part, on the anterior surface, posterior surface, through the posterior surface you will see this posterior longitudinal ligament. Okay. Then in the in this transverse process you will see this intertransverse ligament. So intertransverse ligament present between the transverse process of the two transverse process. So in between two transverse process you have the intertransverse ligament. Similarly, there is superior transverse ligament, lateral transverse ligament, inferior transverse ligament, and levator costa. Okay, levator costa basically presents posterior to the transverse process. Superior transverse ligament present almost anterior to the transverse process, and inferior transverse ligament is present inferiorly. Okay. And on the spinous process you will see supraspinous ligament and interspinous ligament. So one supraspinous ligament, this is the supraspinous ligament, and in between the spinous process you will see interspinous ligament. Okay. So the upper and the lower borders of the body give attachments in front and behind respectively to the anterior and posterior longitudinal ligaments. Upper borders and lower parts of the anterior surface of the lamina provide attachments to the ligamentum flava. So basically here posteriorly, this is your lamina, two lamina. So in front of this lamina you will see ligamentum flava. Okay. Now coming to ossification centers. So basically we have 3 primary ossification center and 5 secondary ossification center. Out of these 3 primary ossification center, one arises from this centrum. Here present one primary ossification center. This is known as centrum. This region is known as centrum. And 2 other ossification center appears at this pedicle part, or better to say neural arch. This is so better to draw it here. Neural arch. So these things get fused together to form the vertebra. So during our, during our birth, these things are placed separately. So here synchondrosis joint formed in between this pedicle and the vertebra. Body of the vertebra, we have synchondrosis joint. So one primary center is present at the centrum and 2 are present at the neural arch region. These get fused together. Then on the latter half we get secondary centers on the upper and the lower surface of the body, and one on each one of the transverse process and another one on the spinous process. So on the upper part of the body, then lower surface of the body, one on each one of this transverse process and one on the spinous process. Okay. These are the secondary centers. These secondary centers appear at 15 years of life and get completely ossified by 25 years of life. And the 3 primary centers, they are one from the centrum and one from each half of the neural arch, appear during 8 to 9 weeks of fetal life and then get fused by 25 years of life almost. Basically not 25 years of life, the centrum gets ossified with the neural arch at first year of life, and those neural arch ossification center, they get fused by 5 to 6 years of life. By 25 years of life, the secondary centers get fused. So these 5 secondary centers, they get fused by 25 years of life. Now coming to certain clinical anatomy part. So these things I have already covered. Spina bifida is failure of fusion of the 2 halves of the neural arch. So this is your neural arch. If in neural arch you have 2 ossification center, 2 secondary ossification center, if these things don't get fused with one another, then we call it spina bifida. Then sometimes the body also, usually in body there is only one primary center. But in case of certain conditions, there are 2 primary centers in the body. So when 2 primary centers are present in the body, then if one of them don't get fused with the other, then we will get one hemivertebra. Hemivertebra means half vertebra. That will result in lateral bending of the vertebral column, ultimately leading to scoliosis. Okay? Ultimately leading to scoliosis. Then this is the intervertebral disc I was talking about. So this is your anulus fibrosus. Inside you have nucleus pulposus. So after 20 years of age, this nucleus pulposus comes out due to straining of the vertebra. This annulus fibrosus get broken. So due to breaking of the nucleus annular fibrosus, this nucleus pulposus content comes out. And when this nucleus pulposus content comes out, it presses on this spinal nerve. And due to pressing of this spinal nerve, if sciatic nerve gets involved, then we call it sciatica, because usually this happens in our lumbar vertebra region. So that's all.